Welcome to our Freedom from Suffering Now blog. I'm Dr. Steve Grinstead. Today I want to talk about a topic that's very near and dear to me, and that's how do you address a person who is having both chronic pain and a coexisting problem, including addiction. You know, it's a very complex problem. That's one of the reasons that I've been working with this population for the past 30 years is because I love complex. I love to get in and try to help make a difference in people's lives. That's why I developed the addiction-free pain management system. One of the things that was really important for me when I was working through my doctorate program was my dissertation was on managing pain and coexisting addiction. And that later got turned into my book, Managing Pain and Coexisting Disorders, using the addiction-free pain management system. And what I want to talk about today is it takes a really complex, concurrent approach for somebody who's living with chronic pain and has coexisting problems, including addiction. The first thing that needs to happen is there needs to be a multidisciplinary team in place and doing a complete assessment. We need to have mental health, addiction, and medical working collaboratively together so we get to look at the whole picture, the whole person. And then what I find it really important is to meet the person where they're at. So concurrent treatment doesn't mean that if you have 100 units of treatment available, you use 50 for the pain, 50 for the addiction. That isn't what it's about. It's about you do the assessment, you do like a triage. And if the person has a predominant addiction problem, they're way over-medicated, they have a lot of acting problems biologically, psychologically, socially, or spiritually, you need to focus in most of your energy there, but you never take your eye off the pain management piece. On the other hand, if someone is in acute pain flare-up episodes, you better be helping them break that pain cycle before you start addressing the addiction, but you don't want to take your eye off of that piece either. So concurrent treatment means you deal with both issues at the same time. And it takes a team to do this. You know, I work really well with mental health and addiction, but the medical issues is beyond my scope. So I have to work with medical colleagues, doctors, nurses, nurse practitioners, physician assistants, etc., physical therapists, chiropractor, acupuncturists, different teammates to help make sure the person's getting their needs adequately addressed. And I believe successful and effective chronic pain management needs an integrated multidisciplinary team approach. My addiction-free pain management system talks about utilizing 3 core components. The first one, and they're not in any particular order here, but the first one I want to talk about is developing an effective and safe medication management plan. I'm not anti-medication, but I want to make sure the person has safe medications. And if they're in recovery or need to be in recovery, they need to be recovery-friendly medications. And also, some people might need medical procedures, up to and including a surgical procedure. Other people might benefit from some epidural injections, some facet joint injections, etc. Some people may benefit really well with acupuncture. Now, the next piece is to deal with the psychological and emotional components of the pain. And that is something I really love doing with people. Matter of fact, the very first thing I work with people on is to help them differentiate between their physical symptoms and their psychological emotional symptoms, and then to develop a treatment plan that addresses those psychological emotional pieces. And then the third, and I think most exciting component, is the non-medication based, the non-pharmacological interventions using a proactive, strength-based approach with people, helping them find things besides medication, exercise, diet, nutrition, meditation, stretching. It can be a lot of different things, and it's going to be different for each individual. You know, if you're watching this on YouTube, please go to my professional blog link or check out my book, Managing Pain and Coexisting Disorders, at that link. I really want to support people in effectively managing their chronic pain, have a good quality of life, and if they're in recovery, to avoid potential relapse. I believe that freedom from suffering is everyone's right, and it's also a responsibility. Today, I want to invite you to partner with me check out our Freedom from Suffering Now website, because there's many different ways that we can work together. Thank you for your attention, and please stay tuned for future blogs.